for my entire medical career, I've noticed that when patients get a scan or a blood test or something that suggests they may have cancer, it's an extraordinarily stressful period. And what often happens in most places throughout our health system is that they have to work with their primary care doctor to get additional testing, sometimes a biopsy, and only then do they get referred to the appropriate cancer specialist who then gives them a treatment plan. And so for the patient and their family, that's just months in some case of uncertainty. So we decided to change that. So from the first time of suspected, like you may have cancer, to getting a actual treatment plan of this is what we're going to be doing to treat you, usually in most places about 3 to 4 months. Well, it's just because I've noticed over the years that that's a very stressful time for patients, and that's the worst time of their life often. They're getting a potential diagnosis of cancer, so we wanted to eliminate that stress window. We've had fantastic results. Patients are so thankful. We are often able to get them into clinic same day, next day, and then we sit down with them and we go over what are all the options, and then we expedite all the rest of the testing that's needed. And so we often go from suspicion of cancer to a diagnosis and treatment plan in a matter of 2 weeks. It took about a year of preparation. We had to not only hire and train the provider, we had to create a specialized authorization process, because that's some of the delay is waiting to get authorization from insurance companies for all the testing. So we created a dedicated team to work on that. And then we had to create processes with all of our specialists to make sure that patients could get into urology, surgery, interventional radiology, et cetera, right away. I think it's a unique offering that we have. I'm not aware of any other place that does this. Hopefully others will mimic it. But I think in general, cancer care has improved over the years at most places in terms of being more patient-friendly. Many places like us have navigators to help hold patients' hands throughout, because navigating the healthcare system is incredibly challenging.
Yeah.
Well, patients want to know, what does the future hold? Otherwise, they assume the worst. It's just human nature, right? And so getting an answer of what is the diagnosis, what's the treatment plan, it sets patients' mind at ease. Not to mention, any delay can result in the cancer growing, and then it can become metastatic and no longer able to be cured.
So we were at an Eagles concert in Las Vegas, and as I was getting dressed, I noticed that on my right breast there was a small formation, and it over the course of 2 weeks it grew, and it was concerning because it was such a quick growth. Mm-hmm. So we have a family friend who works here, mm-hmm. and her name is Alex Armitage, and she was able to get us in. We called her one afternoon, and by the next afternoon we were here at Temple, mm-hmm. at the Early Detection Center. They put me through a series of tests actually, and it was remarkable because they did them all in one day, so that because I had traveled. So I first saw one of our PAs here. She was fantastic, mm-hmm. super sweet, and she did a breast examination because we do have a long series of breast cancer in our family. After that, she sent me to dermatology, where both a doctor and a resident took a look at the spot. They were not overly concerned, but they went ahead and did a biopsy on it, which was, it gave me some peace of mind to know that it was already in good hands. Mm-hmm. Then I was sent to imaging, and I had a mammogram and an MRI. And then I returned to the PA where she gave me instructions about care and when I would receive those results. And within 2 days I had the results. It was fantastic. So they did, and in addition they did blood work. So all in one day I was able to knock out all of those things that would, in my hometown, would take 6 months or better to see every one of those physicians. And here it was very rapid, super sweet, super kind. Mm-hmm. They gave you the feeling that they really cared about you, and that's a rarity in medicine today.
Yes.
Sure, they said it was benign, and just to keep up with my mammograms and usual female health But it was so expedient that you couldn't ask for better medical care than what I received here. It was fantastic. And I have to say that the staff that arranged everything bent over backwards to make sure that I could get in one day because I had traveled so far. They didn't want me to have to make multiple trips. So not only did the doctors work hard for me, but also the scheduling staff was absolutely over the top. Fantastic. My gynecologist, he's booked out 6 months. We do have a primary doctor, but even that would take up to a couple of weeks to get in. Then he would send me to, of course, professionals that here are all in one place. So I didn't have to run all over town. They were centralized. I could get to them very easily. Whereas in my hometown, I would be running all over trying to find the specialist that I needed. And then it takes quite a bit longer to receive those results. It's extraordinary that in one day I saw everyone. 2 days later I had an answer. Because we have a history of breast cancer in our family, it was an extreme sigh of relief because I was so concerned that it was something, because it was growing so quickly, I assumed that it was probably something bad. But each individual that I saw reassured me that they felt it would be okay. So either way, I felt like, well, if I get a poor result, then I'll have great care here. If I get a good result, I'll get great care here. So it was a sigh of relief. My advice is absolutely get into the early detection center. Give them a call because they're going to do their best and work hard for you to get that to happen. And it gives you peace of mind. You know, the further you kick something down the road, the harder it gets. But for me, it took something off my mind and my family. They were all concerned as well. So you're not only helping yourself, you're helping your family, and especially when you have a family history of something, be it cancer or any other disease, early detection can really help save your life. So the sooner that those doctors and medical professionals can get to you, the better off you're going to feel, and the sooner they can help you.
Oh my gosh, it is of the utmost importance. So that is the heart behind the early detection clinic. We want to find the cancer early and get a diagnosis as early as possible, either of cancer or to rule that out for peace of mind. So there are many well-known benefits of getting a cancer diagnosis early and being able to plug a patient in with the right treating oncologist as early as possible. Patients are shown to have lower risk of morbidity, meaning the complications due to cancer and mortality rates are decreased as well if we can catch this in something like a stage 1 or even stage 2 versus a stage 4 diagnosis. And so we really do want to work up these patients as soon as possible, get the imaging and the diagnostics such as a biopsy or further labs or imaging as soon as possible. I feel like the feedback has been nothing but positive things. So from primary care doctors, I've heard, oh my gosh, thank you for getting my patient in right away. And we have a special authorization team that makes sure that their biopsies, their imaging is approved. And we actually have an average approval rate of less than 4 hours to get things approved by insurance for these patients to be able to get the diagnostic workup that they need, which is remarkable. And so usually this can take, on average, about a week or so in other specialties. So this is a major, major improvement, and primary care providers, providers from the emergency room and from the hospital are really grateful for that. So I would love to just share some education about the red flag symptoms of cancer. So these are kind of our cardinal red flag symptoms to look out for. And that's going to be unintentional weight loss. So not changing your diet, not changing your exercise, not on any weight loss medications, but you're dropping weight rapidly. Your clothes are fitting a lot looser. That's one of the red flag symptoms. Drenching night sweats. This can be kind of difficult for my patients that are walking through menopause, but generally these are going to be nightly drenching night sweats where you have to change your clothes or change your sheets. The last red flag symptom is going to be unexplained fever. So you're not sick, but you're feeling feverish otherwise, and this is happening frequently. And so those are the 3 main red flag symptoms. Other things to look out for are new or severe headaches, specifically if you're laying down flat and you develop a headache. And then if you have blood in your stool or changes with new constipation or new diarrhea, that would be a reason to go get a colonoscopy right away. So within the Baylor Scott White system, or really seeing any healthcare provider, providers can provide a referral directly to the early detection clinic.
Okay.
Patients can also call if they've been told that they have a concerning symptom or finding on labs, imaging, or physical exam. They can give us a call. The phone number is 254-724-4357.
Okay.
And that will connect you to my scheduler directly. So yeah.
Wow.